Again, thank you for joining us and welcome to our well-being webisode, Live Longer, Live Healthier, Tips for Healthy Aging. I am Kelly, a Senior Health Services Specialist at Geisinger, and with me today is Dr. Ricky Heath. Dr. Heath is a board-certified geriatrician, internal medicine physician, and dementia specialist. He completed his internal medicine residency at the University of Connecticut and fellowship training in geriatric medicine at Johns Hopkins School of Medicine. Currently, he serves as an assistant professor of medicine and population health at Geisinger Commonwealth School of Medicine, and he is an attending physician at the 65 Forward Clinic in Pottsville. Dr. Heath is dedicated to improving the health and well-being of older adults through clinical care, education, and quality improvement. Today, we're going to discuss the aging process, review factors that influence aging, and identify ways to promote good health as you age. I do like to note that all of the information we provide today is to increase your awareness. It is not meant to diagnose or be specific medical advice for you. If you believe you have any medical conditions or specific questions regarding your health, please see your physician. Welcome, Dr. Heath, and thank you for joining us.
Thank you for having me.
So to get started, we all know that aging is probably not a topic that many of us enjoy thinking about or talking about, but it is a natural process that occurs in all living organisms as they progress through time. So it's important to understand this process. Dr. Heath, would you say there is an expected age at which the process of aging begins?
So the aging process, it actually starts a lot younger than most people realize. Many of the changes associated with aging, such as decreasing muscle mass, slowing metabolism, changes in vision and hearing, all begin in our late 30s to mid 40s. How these changes affect us and how quickly they progress, it varies significantly from person to person, and it's influenced by a combination of factors. Environmental exposures, lifestyle choices, and to a lesser extent, our genetics.
So it sounds like there is an age, but it's an individualized experience that may begin and occur at different rates. So you've mentioned some things like decreased muscle mass, but what other types of changes can we anticipate with the aging process? And are there any common signs and symptoms of aging?
Yes, common changes that occur with aging are that many people are aware of are changes in vision and in hearing, which are noticeable, and oftentimes we can overcome them with glasses and hearing aids. Many of us also experience a natural slowing down. So, for instance, it might take us a little bit longer to read a book, maybe a little bit longer to finish the newspaper. We might not walk or run as quickly as we once did, and even getting dressed in the morning could require a bit more time. These changes are normal and expected, but they shouldn't prevent us from doing things that we want to do. If you find that the tasks become impossible or challenging, then it's important to see your medical professional just to rule out other potential health issues.
Yeah, that's good to know. And kind of like I started with at the beginning, I think many people have maybe negative perceptions or feelings about aging. I mean, me personally, hearing that I could start in my late 30s, my clock is ticking. Um, but these negative thoughts can create fear, maybe anxiety of what lies ahead. So what advice do you have for people experiencing these negative thoughts about aging? Are there benefits to aging that we should kind of consider and flip that negative thinking toward?
Absolutely. It's common to have concerns about aging, but it's also important to recognize that growing older is often associated with everything that we strive for in life, particularly happiness. So repeated studies have consistently shown that happiness scores tend to increase as we get older, particularly after age 7. Age is often associated with experience, increased wisdom, and importantly, a stronger sense of self, of who we are. Additionally, as we grow older, we tend to have more freedom to choose how we spend our time, and we get the ability to focus on what matters to us. So accepting aging as a part of life allows us to live more fully and knowing that our happiness, which is what everybody tends to look for, increases as we get older, I think is a good start.
Yeah, no, that's so interesting that happiness scores are higher. Wow. Very, very interesting. So I know you've mentioned a few things already, I often joke that we can't stop the passage of time, but, are there ways to prevent aging or slow it down or do it in a more healthy way?
Yes. So aging is a natural process that every person and every organism, as you experience, even trees age. So we can't stop. But while we can't stop aging, we certainly can influence how we age through simple everyday habits. So, for example, things like prioritizing a nutrient-rich diet, such as the Mediterranean diet, for example, which is rich in fruits, vegetables, whole grains, healthy fats, can make a big difference. Staying physically active and socially active is equally as important. Doing group exercises like dance classes or group aerobic classes is a good way to do both at once, socialize and stay physically active. Making sure we're getting adequate sleep, something that becomes easier when you eat well and you're active. And avoiding smoking. All of this is crucial for healthy aging.
Yeah. So, a healthy lifestyle, we are the health and wellness team, is something we focus a lot and discuss a lot on these webisodes. And you've already kind of answered my question here that, a healthy lifestyle really can play into the aging process. But would you say there's any research to support whether it can extend an individual's lifespan following a healthy lifestyle?
Yes, healthy lifestyle is probably the most significant factor for impacting both our lifespan and our health span. So how healthy we are um, as we get older. There's a 2006 study on over 20,000 Danish, Swedish, and Finnish twins that found that genetics only account for about 20 to 30% of variation in lifespan, with the remaining majority determined by environmental factors and lifestyle choices. This means that for most of our lives, how we live, how we eat, how active we are, and the habits we maintain has the largest impact on how well we live and how long. So if we think about that for a second, we have considerable control over our longevity just through the choices we make every day.
Wow. Those percentages are definitely more than I would have I would have thought because I feel like you often hear, family history, genetics is, a risk factor for this. So
It is important, not as it only accounts for about 30%. And until we get into around the late 90s, hundreds, genes have a bigger influence. But for most people, it's the lifestyle that has the big.
wow. Very interesting. Thank you for sharing. So I've often heard both, in my work professionally and then in some relationships in my personal life that, I've never exercised. I mean, my grandmother always tells me, I should have exercised, I should have ate better. Um, is it, and my personal grandma, she's like, it's too late to start now. But is that true, or will an individual still experience the benefits of things like exercise and a healthy diet, even if they get started later in life?
It is never too late to start. And there's plenty of research that consistently shows that even individuals who begin exercising later in life can experience significant health. One notable study, the Jerusalem longitudinal cohort study, followed individuals 70 to 88 and found that initiating or increasing physical activity, even in advanced age, improved both survival rates and functional independence. So, for instance, participants who became physically active between ages 78 and 85 had a lower mortality rate compared to those who remained sedentary. The benefits extended to maintaining their ability to perform the things that we do every day, called our daily activities of living, and reducing our risk of developing frailty, so weakness, falls. The study reinforces the idea that healthy lifestyle at any age can positively impact our quality of life and our length of life. And again, simple steps. Exercise and diet is where to start.
Wow. I'll be sure to share that with my grandmother. Um, So, I did, as in preparing for today's, we do have some wellness coordinators in our 65 board. So I kind of got their input on what questions that they get often. And a lot kind of circle around these lifestyle factors that we've mentioned. So I want to dive into those a little bit now, starting with exercise. Um, so how much physical activity do we need? And, should our focus be on strength, cardio, combination of both? All with the thought here of like promoting healthy aging.
Yeah. So I'll start by saying that we don't have to be perfect. Any activity you enjoy, whether it's walking, dancing, lifting weights, all of that will bring benefit. With that said, if we want to get the maximum benefit, particularly for issues related to aging, there are four types of exercise we should aim to include in our routines. Number one, aerobic exercise, activities like brisk walking, so walking at a pace where you could talk but not sing, swimming, golf, biking, dancing, and one of the new favorites, pickleball, are all great examples. We should aim to get aerobic exercise, 30 minutes, 3 times a week. Then muscle training, number two, the muscle strengthening. This includes weight training, resistance exercises, calisthenics with weights. And we should work to get 30 minutes twice a week to maintain muscle mass and strength. So that would bring us up to the commonly heard 150 minutes a week. Flexibility training is essential as we get older. This is key for maintaining independence by enabling us to do everyday activities that we often don't think about, such as bending down to put on our shoes, reaching overhead for objects. So stretching and flexibility exercises can be done twice a week for 10 minutes, ideally after aerobic or strength training when your body is warmed up. But you should also stretch beforehand as to prevent injury. Then the fourth bucket is balance training. This helps to prevent falls and improve stability. Tai Chi is a wonderful example in many local centers or for the area aging on agency, offer Tai Chi and chair yoga classes. So it might sound like it's a lot, but I can't stress enough how vital exercise is for healthy aging. Regular physical activity is one of the most impactful things that we can do to live longer and stay healthy, associated with lower risk of death from any cause, reduced anxiety, reduced depression, improved bone health, improved cognition, and a lower risk of dementia, as well as fewer falls and injuries from falls. So putting all four together, if we can, is the best way to maintain a healthy age.
Yeah, wow, great. Thanks for that insight. And, something that stuck out to me was, finding what you like to do and, starting, maybe you're not at that 150 minutes, but, anything is better than not doing anything. So,
Yes.
so what would your advice be if, somebody's on this call today or watching this later and they're fairly sedentary at this point, and maybe they feel motivated to just get started. What tips, what advice would you have for them on becoming less sedentary?
3 tips. One is always start low and go slow. If you're not already engaging in regular physical activity, don't try doing everything at once. Start small. I usually recommend walking 3 times a week for just 5 minutes at a time. It's easy to commit to, and it's about the time that it takes to listen to two of your favorite songs. Carries a low risk of injury and is manageable for most people. I then tell most of my patients to add 5 minutes each month. And by the time you come back to see me in about 4 months, you'll be up to doing 20 minutes of aerobic exercise 3 times a week. And then from there, you can gradually increase. Second tip, do something you enjoy. Physical activity doesn't have to feel like a chore. Choosing something that brings you joy, walk with a friend or your dog if you prefer, go for a bike ride, take a swim, play around a golf. When you enjoy the activity, it's easier to stick. And then the last one is just take the extra step. If the first 2 tips feel overwhelming, focus on simple changes. Take the stairs instead of the elevator. Park at the far end of the parking lot instead of circling for the closest spot. If you enjoy watching TV, pick 3 shows and commit to moving during every commercial break. It might not seem like much, but every small step adds up. Important to remember, you don't have to be perfect. We're just aiming to be a little bit better. Small, consistent efforts can lead to meaningful progress.
Yeah. That's really helpful, and hopefully will give those who need that little extra push or aren't currently exercising some ideas on how to get started. I think too often, especially with New Year's, people are like, gotta do it all, gotta do those intense, workout routines. But those small changes really add up. And
Absolutely.
I think, my background in nutrition and being a dietitian is, it's the consistent changes that impact our health, not just ones we do for a week. So thank you. Now, nutrition, you've talked a little bit about already. And you've mentioned how important a balanced diet is. But one change I think we hear from, seniors or people as they age is a decreased appetite. So Dr. Heath, how do we address a poor appetite, and what foods or food groups should we be sure to include in our diets?
Yeah, decreases in appetite as we age can be quite complex. There's natural changes that occur with age, such as reduced taste sensation. We lose about 70% of our taste buds, diminished ability to smell. That affects the taste. If you think about how an aroma of coffee or food can spark hunger, decreased sensitivity to temperature and texture in our mouth, all of these factors contribute to a diminished appetite and is natural with aging. Additionally, certain medications and medical conditions like depression, constipation, difficulty swallowing, this can further affect our appetite. So if you're experiencing a lack of appetite accompanied by weight loss, the first step is always to speak with your medical professional to make sure there's no underlying causes. Now, when we're trying to address poor appetite, trying to eat smaller, nutrient-dense meals, high in fruits and vegetables, whole grains, proteins, and healthy fats, that is very beneficial, and it doesn't require a big appetite if you keep it small and regular meals. Enhancing flavor with spices and herbs can help to compensate for some of the natural decline in taste. Incorporating a variety of colors and textures into meals can also make them more appealing. And staying hydrated is important, especially when managing constipation. Increasing physical activity can also help. So all of this is very important.
Yeah, so small, frequent meals, those fruits, vegetables, whole grains, lean protein, enough hydration, lots of good things to remember, and adding spices to deal with the decreased appetite. I think also another topic I wanted to address is bone health. I know as we age, we're become at greater risk for fractures and maybe certain conditions affecting our bones like osteoporosis. So what can we do to improve our bone health?
Yeah, so keeping right along the same lines, exercise and nutrition are critical for maintaining bone health as we age. Training exercises are particularly effective in preserving bone density and preventing bone loss. But even something as simple as increasing your daily walking can significantly reduce your risk for fracture. Proper nutrition is just as important. Ensuring your diet includes adequate calcium and vitamin D. And by adequate calcium, I mean about 1,200 milligrams of calcium a day. This is essential for strong bones. Whenever possible, we should aim to get these nutrients through food sources, such as dairy products. And I know lactose intolerance increases as we get older, but you can also get increased calcium from green vegetables, leafy green vegetables, fortified foods. Nuts are a good source of calcium. And we should also make sure that we're avoiding behaviors like smoking and excessive alcohol consumption. These all affect bone health negatively.
I definitely think the message has been loud and clear
Yes.
about exercise and sound nutrition, which is great. We're always, we're always championing that message here in the health and wellness team, and it's good to hear it from others too. So I'm sure everyone on this call has heard just how important it is to go to your doctor for things like your annual physical, make sure that you're staying up to date on your preventative screenings. I've heard people say, oh, I only go to the doctor when I'm sick, and I'm sure that's not the message we should be portraying. So I do think, between thinking you only need to go when you're sick and the busyness of life, I feel like many people continue to find themselves putting annual physicals, preventive screenings off. So can you talk a little bit about how important it is to visit your doctor regularly, especially as we age?
Yeah. So regular visits to your medical professional doctor become increasingly important as we age. These checkups tend to need to occur more frequently to monitor critical aspects of health, such as things like balance, falls, nutrition. Routine visits also ensure that you're up to date on all your preventive measures like bone density screening and vaccinations. So seeing your doctor regularly allows for better monitoring and tracking of any symptoms you might be experiencing. Helps determine whether these symptoms could be from typical aging, things that we expect with aging, if it could be a side effect of a medication, or if it could be a sign of a new health condition that requires further investigation. When appointments are infrequent, such as just an annual year visit, it can be harder to differentiate between, okay, so it's normal aging, is because of medication we started a couple months ago. So it's important to see your doctor regularly and be proactive about maintaining your regular checkups.
Yeah, I just attended something yesterday about, really changing our way from being reactive in our health to proactive. So thank you for sharing that insight. I think we've discussed many ways, especially physical activity and exercise, that'll help keep us healthy as we age. Are there any other tips or recommendations you want to leave our audience with regarding healthy aging today?
Yes, I think if everybody walks away knowing that the old adage, use it or lose it, is true, we'll do fine. Embrace lifelong learning, stay curious, engage in activities that challenge your mind, puzzles, reading, learning a new skill, maintain strong social connections by spending time with family and friends, prioritize your mental health well-being, in activities that bring joy. Uh, Remember, aging is a great time for happiness and satisfaction. So if we embrace it with a positive mindset and a proactive approach to health, you can't help but do well as you age.
We do have one more planned question, but I did get one here in the chat that I want to address. Is lab work important to request to better understand current health? This isn't something my PCP has ever mentioned or requested. If yes, which labs would you say are key?
Well, I think screening labs. So I know there's a lot of push for different types of labs, testosterone levels, these microbiome testing, which is not ready for prime time yet. We don't know how they truly benefit our health, but your routine checkups and your routine labs are important. It is important to note that what type of labs and how frequently you should get them labs are more dictated by your medical condition. So not everybody is on the same lab schedule, and not everybody needs to have the same labs on the same frequency. It really is determined by your health.
Thank you. Thanks for that question. Um, Our last planned question today, I did mention at the beginning of our conversation that Dr. Heath is a physician at one of our Geisinger 65 forward clinics. Can you tell us a little bit more about that program, where to learn more about it, and who is eligible to participate?
So 65 Forward is dedicated to people who are over age 65. So it is a program specifically designed to help people as they are aging. It has everything that we just mentioned. We just talked about with healthy aging. So we have a wellness coordinator and a fitness center. So that will help you with your exercise. They're in the clinic, and you can go to their classes on a weekly basis, multiple times a week. So that gets your physical activity. We also have availability for nutritionists. So if you're having any issues with nutrition or you just want to be healthier with your diet, we can get you access to the nutritionist. We have a pharmacist to review all of medications. You see a doctor more frequently. At this time, it is doctors that you see at every visit, and we usually see you at least 3 times a year, so every 4 months. In order to join our program, you just have to be over 65, and you do have to have Geisinger insurance, Geisinger Gold insurance. Now, if you don't have Geisinger Gold insurance, that's okay. You get about a year to come, enjoy your benefits, and see if this really is a program for you and if it fits. And if it does, you just switch over your insurance and stay with us. Most people end up doing that.
Wow, great. Sounds like a one-stop shop. Exercise, you can
Absolutely.
get your pharmacy.
I
So
should also mention that we have been recognized as an age healthy system, so aging healthy system. So that's important to mention for 65 forward because we are dedicated to help people.
great. Well, that brings us to the end of our conversation today. I want to say thank you to Dr. Heath for sharing his experience and tips with us today. And I want to thank also those who have tuned in to listen. We hope you found this information useful and relatable. We do have a few minutes, so I'm going to pause to see if any questions come into the chat. But if at any point other questions come up or feedback for myself or Dr. Heath, please send them to wellness@geisinger.edu and we'll be sure to get back to you. And we do invite you to join us next month for our kickoff presentations for our annual Spring into Wellness Challenge. So if you're feeling motivated to get moving, this is a great steps challenge, lots of fun. So check this out in February to learn more. So I'll just pause here for a moment to see if any questions come in. Dr. Heath, we did have someone share that this was great information, and thank you for your time. Not seeing any questions, but that's okay. Thank you again. And if anything comes up, wellness@geisinger.edu. I'll connect with Dr. Heath and we'll get you a response. But thank you all. Stay warm.
Thank
Have a
you.
good rest of your winter, I guess. I'm ready for spring. Oh, wait, we might have a new, just more people saying thank you. All right. Well, this concludes our session. Thank you so much, Dr. Heath.
Thank you.